Part 3 of hallucinogens will be focusing on cannabis. So cannabis possesses depressant effects. It is the only hallucinogen that produces physical dependence. So there is a withdrawal and a addicting. So it is classified as a hallucinogen, but it does have the ability to alter perception at low doses and hallucinations at higher doses. It works on different neurotransmitters than other hallucinogens, though. So the actual plant is called Cannabis sativa, which is the flowers, leaves, and shoots produce cannabis. There is obviously widespread use. This plant grows easily in most climates, but incorrectly thought to have minimal negative consequences of use. So in fact, it does have significant consequences to use. So THC, or delta-9 tetrahydrocannabinol, causes psychoactive effects in cannabis, and there are endocannabinoid anandamide, which is the specialized receptors in the brain. So there are receptors in the brain that are wired to receive THC. So when you smoke it and it reaches the brain, there are receptors that fit perfectly to the THC. So there is a link there that I'd like you to take some time to look at from KMH regarding cannabis. So I'd like to pause now. So cannabis, once it's inhaled, the effect is felt within seconds and full effect within minutes. So once it's ingested, the blood concentrations are 25 to 30 less than when it's smoked. The effect is also delayed. So it takes about 30 to 120 minutes, and the duration is longer. So THC binds to THC receptors in the brain, so the anandamides, that are located in the reward pathway of the limbic system in the brain. So again, this is likely why it's addictive. It regulates the integrity or integration of sensory experiences with emotions, controlling functions of learning, motor control, and some autonomic nervous system functioning. So some automatic systems in the body. So THC also impacts the hippocampus, which is the memory center. It also impacts the cerebellum, which is coordination and balance. So anybody who is intoxicated on cannabis, they will be off balance. And cannabinoids are very lipid soluble, so meaning fat soluble, and they accumulate in the fatty tissue in the body. So therefore, if somebody were to have a urine sample taken up to 30 days after smoking cannabis, there could still be a essence of cannabinoid in the urine, because it takes about 30 days for a single dose to leave the body. And then, of course, the more you use it, the level in the body accumulates and continues to reach the body or the brain with greater concentrations. There are some therapeutic uses for cannabis. So relief of nausea and vomiting caused by cancer treatments, and it helps to increase appetite for people who are being treated for HIV. It also aids in the treatment of glaucoma, muscle spasms, MS, decreases issues of rejection in organ transplants, and seizures from epilepsy. It also alleviates gastrointestinal disorders, depression, anxiety, and tension. There's also a decrease in chronic pain and aid with falling asleep. So the link there is for Health Canada. It's regarding understanding the new access to cannabis for medical purposes and the regulations surrounding that. So I'd like to take a few minutes just to look over that. So there are no pharmacological difference between medical marijuana and illicit marijuana, so it is essentially the same, except that the medical marijuana is regulated and quality ensured that there are no other additives. So a lot of marijuana can be spiked with other things. So people, when they're selling marijuana on the streets, they could have added various other substances to the cannabis, but medical marijuana is pure marijuana and not adulterated with any other substance. There are limits to the therapeutic potential because there are acute and chronic side effects to using cannabis, and also tolerance can develop quickly to some of the benefits. So at low to moderate doses, so it's similar to alcohol, so it relaxes, have disinhibition, euphoria, talk and laugh more than usual, but it can also cause unpleasant effects, It's like increase in pulse, heightened appetite, red eyes, feeling sleepy, impairing short-term memory, your logical thinking and ability to drive due to impairment of judgment and motor control. So again, not just alcohol, but any substance impairs your ability to drive, and same with cannabis. So the changes in perception of time, distance, touch, sight and hearing, and affects your balance. So like I was saying, the marijuana is the second most common cause of impairments, leading to traffic collisions. Alcohol is number one, but it's the most common cause of traffic accidents in males 18 to 30 years old. So with very large doses, the effect is similar to that of LSD. So there's anxiety, mood disorders, confusion, restlessness, depersonalization, excitement, and acute psychosis. Flashbacks can occur, and these appear days to weeks after the acute drug effects have worn off. So even after you don't feel the high anymore, but you can have flashbacks. It can also trigger or enhance psychotic episode in a person with a family history of psychosis. So somebody who continued to use cannabis during a first episode of psychosis will experience higher levels of illness, lower psychosocial functioning, less insight into their illness, lower premorbid functioning. So even if their psychosis were under control, they won't function like they used to, and a longer duration of untreated psychosis. So continued use is linked to worse outcomes and a greatest degree of social disengagement. So the link here, there's a few videos on this webpage, but one is specific to psychosis in cannabis. The doc is a doctor named Kwame McKenzie, and I'd like to take a few minutes just to look at those videos. So long-term effects of cannabis, so looking at cognitive difficulties, impairment in concentration, memory and abstract thinking, emotional instability or disengagement, apathy, learning deficits, decreased energy, and increased risk of depression. Decreased ability to fight infections, a great risk of head, neck, and throat cancers, increased endocrine system difficulties, decreased testosterone and sperm count, inhibition of ovulation, and decreased fertility. So it'll be harder to get pregnant, either being a man or a woman. Won't be able to, or decrease in your fertility. It has more damage to the lungs than tobacco does. So the intake of tar and other carcinogens is greater with cannabis. The amount of carbon monoxide is higher in the blood with cannabis. And there's increased risk of lung cancer, increased tar exposure, decreased immune response, increased risk of tumors, increased oxidative stress, and bronchial abnormalities. So a tolerance to cannabis can develop within 1 week of multiple times per day. So less frequent users develop tolerance to desired effects within several months. There is physical and psychological dependence. Withdrawal usually starts within about 8 hours of stopping. Feelings of irritability, insomnia, anxiety, depressed mood, restlessness, anger, sleep disturbance, weight loss, sweating, and intestinal cramps. So a green out, a bit of a slang, it's a feeling of unwell after smoking cannabis. So you actually feel pale or green, sweaty, dizzy, nauseous. It's similar to an overdose, so combining cannabis with alcohol increases the chances of a green out. So using cannabis in late adolescence and early adulthood lead to adverse outcomes later in life. So poor education outcome, lower income, greater dependence on social assistance, greater unemployment, and lower relationship and life satisfaction. So synthetic marijuana, so this is created in a laboratory. So it's also called a designer cannabis or herbal marijuana. In an effort to avoid legal restrictions and avoid a positive test on a toxicology screen. So people that are trying to create a marijuana effect but not be caught for having it. So common street names are Spice or K2. It's a mixture of plant material and chemical grade synthetic cannabinoids. So brand name of IZMS. So it's available online or in specialty shops. It's marketed as potpourri and labeled not for human consumption, so that way it's not illegal because it's saying don't use this for human consumption. Smoking this drug is similar to cannabis except it's more toxic. More negative side effects, so seizure, kidney damage, psychotic behavior, fatal heart attacks, severe agitation, potential poisoning. So here are 2 or 3 links to the information that will be coming out in summer 2018 regarding legalization. So they're specific to Ontario, and then there's the Government of Canada sites regarding legalization of marijuana.